A 68-year-old woman named Mary was gardening one morning when she suddenly felt weakness in her right hand. She thought, "Maybe I slept wrong, maybe it's nothing." She ignored it, had lunch, and went on with her day. By evening, Mary was rushed to the hospital with a full-blown stroke. What Mary didn't know is that her body had been warning her hours before the stroke happened. Most strokes don't just come out of nowhere. In fact, research shows that up to 80% of strokes give warning signs beforehand. Recognizing them early and acting fast can literally save your life or the life of someone you love. So in today's video, I'm going to walk you through the 7 early stroke warning signs seniors must not ignore. I'll explain them in simple language, give you real-life examples, and at the end, I'll share the #1 action you must take if you notice any of these symptoms. 1. Sudden numbness or weakness. The most common and classic warning sign is sudden weakness or numbness in the face, arm, or leg, especially on one side of the body. Why does this happen? When blood flow to part of the brain is blocked, the nerves controlling movement and sensation stop working properly. The result, weakness, heaviness, or numbness. Example: imagine trying to pick up your coffee cup but your hand just won't grip. Or you look in the mirror and notice one side of your face drooping when you smile. This is not normal aging. It's not just fatigue. It could be the first sign of a stroke. Doctor's tip: ask yourself, or the person with symptoms, can you raise both arms? If one drifts downward, that's a red flag. Question for viewers: have you ever felt sudden weakness in your arm or leg, even if it went away quickly? Share your experience in the comments. It might help others. 2. Trouble speaking or understanding words. 4:30, 6:30. The second sign is sudden confusion, trouble speaking, or difficulty understanding what others are saying. You might open your mouth to talk, but the words come out slurred or jumbled, or you might be listening to someone, and suddenly their words don't make sense, even though you can hear them clearly. Example: a man in his 70s told me he once tried to order a sandwich, but instead of saying turkey, he said turtle, and couldn't figure out why the cashier looked confused. That was actually a mini stroke, or TIA. If speech suddenly becomes slurred, or if someone struggles to form simple sentences, don't assume they're tired. It could be a stroke in progress. 3. Vision problems. The third warning sign is sudden vision changes. This might mean blurred vision, double vision, or loss of vision in one or both eyes. Why does this happen? When the stroke affects the part of the brain that controls vision, the eyes themselves may be fine, but the brain cannot process the image correctly. Example: a 72-year-old patient told me he suddenly couldn't see out of his right eye while reading the newspaper. He thought it was just an eye problem and made an appointment with his eye doctor. By the time he got checked, he had already had a small stroke. So remember, if your vision suddenly goes blurry or you lose half of your visual field, call 911 right away. 4. Dizziness, loss of balance, or trouble walking. The fourth sign is sudden dizziness, difficulty walking, or loss of balance and coordination. Many seniors think, well, I'm just getting older, maybe that's why I'm a little unsteady. But here's the truth: sudden, unexplained balance problems, especially if combined with nausea or vomiting, can mean a stroke in the brainstem or cerebellum. Example: One gentleman I treated fell backward in his living room because he suddenly couldn't keep his balance. His wife thought he was dehydrated, but the CT scan showed he was having a stroke. If you feel like the room is spinning, or if your legs suddenly don't support you, don't ignore it. Question for viewers: have you or a loved one ever had sudden dizziness that made you worry? Tell us in the comments. Others might learn from your story. 5. Severe, sudden headache. The fifth sign is a sudden, extremely severe headache with no clear cause. We call this the worst headache of your life. It comes on in seconds, not gradually, and may be accompanied by nausea, vomiting, or sensitivity to light. This can signal a hemorrhagic stroke where a blood vessel bursts inside the brain. If you or someone near you says, "This is the worst headache I've ever had," treat it as a medical emergency. 6. Sudden fatigue or fainting. Another overlooked sign is sudden fatigue, confusion, or fainting. Some seniors describe it as feeling like their energy just drained out or as if they were about to pass out. While fatigue has many causes, if it comes on abruptly and is paired with other symptoms like dizziness, confusion, or vision problems, it may be stroke-related. Don't dismiss it as just old age tiredness. Pay attention if it's sudden and severe. 7. Nausea or vomiting. Finally, the seventh sign, sudden nausea or vomiting that's not related to illness. This is especially common when the stroke involves the cerebellum, which controls balance. It's often combined with dizziness and difficulty walking. If you suddenly vomit without feeling sick beforehand, and especially if other symptoms are present, call for help immediately. Transition to action step. Now we've covered the 7 major warning signs. But knowing them is not enough. You need to know what to do the moment you see them. If you or someone near you shows even one of these symptoms, here's the golden rule. Don't wait. Don't drive yourself. Call 911 immediately. Why? Because stroke treatment is time sensitive. We often say, time lost is brain lost. For every minute a stroke goes untreated, up to 2 million brain cells die. In the ER, if you arrive quickly, doctors can give clot-busting medication or even remove the clot with a special procedure, but the window is short, usually only a few hours. Acting fast can mean the difference between walking out of the hospital versus living with permanent disability. So let's review quickly. Sudden numbness or weakness. Trouble speaking or understanding. Vision changes. Dizziness or loss of balance. Severe sudden headache. Sudden fatigue or fainting, nausea, or vomiting. These are the 7 early stroke warning signs seniors must not ignore. Now, let me ask you, which of these signs surprised you the most? Have you or someone you know ever experienced any of them? Share your story in the comments. It could help save another person's life. If you found this video helpful, please hit the like button and subscribe, because in my next video, I'll talk about the most effective ways to prevent a stroke after 60. And remember, your health is your wealth. Stay safe, stay aware, and I'll see you in the next video.